Good evening, everyone. I think we'll go ahead and get started. My name is Wanda Wilson. I'm with Oakland Planning and Development Corporation. Thanks for joining us tonight for our Oakland Community-Wide meeting. We're both on Facebook Live and here on Zoom. And we have several presentations tonight. So here's the agenda, if you can see on the screen. And we're going to do a few announcements from OPDC, things we want to make sure people are aware of. And then we have a presentation about a project down at the Pittsburgh Technology Center on 2nd Avenue. And two presentations from the University of Pittsburgh, one that's related to railings at the Cathedral of Learning, and then just their fall semester return plan. We're going to just do a few ground rules for our meetings on Zoom, just so people understand how it's going to work, since we're not in person, but it's still a community meeting and we're glad to see all of you. We can see you in our participant list and on Facebook. I'm going to be watching the chat to see who has questions. And I'll be reading those questions to the presenters. So we'll keep all attendees both muted and off of video. The presenters will be seen on video. And I'll be moderating the Q&A to make sure that everybody's question can be addressed. And if you're just on the phone and not able to use the chat feature in Zoom or Facebook, I will, after I've gone through the chat questions, if you have something different that hasn't yet been asked, we'll be able to have the people who are on the phone unmute their line and verbalize a question. So we'll allow a moment at that point so we can get every question heard. We are recording the meeting and it'll be on our website, and we'll also record meeting minutes in written form as well, and those will be on our website in a few days. I think those are all for the ground rules. And I'd like to just do a few updates from OPDC. As we've said before, even though we're working remotely and the offices are closed to the public, we are still very active in the community, connecting people to resources, getting information out. We're still available by phone and email. We actually come to the office to get our snail mail once a day, so there's somebody to pick up the mail at the office each day. So we're very much around and present in the community. So please reach out to us if you have any questions. Here we have information about food meal distribution in the neighborhood for those who would like to come to Fraser Fieldhouse or Friendship Community Church when there's a meal distribution. The dates are here on the screen. So in South Oakland, it's Tuesdays, Thursdays, and Saturdays, and in West Oakland, it's on Thursdays. So call Andrea, my colleague. Her name and number and email are listed there. If you'd like to have a meal dropped off to your porch, we can do that as well if you give us a call. You can also call us. We have connections to people who are making and distributing masks, if that's still a need that you have, or if old ones that you've had are worn out, you need some new ones, give us a call. We also have a lot of really helpful programs for homeowners to make home repairs. So we really want to make sure people know about that. Our facade grant program is still available, and we have a home repair program for senior homeowners that can provide up to $22,500 for home repairs for your home. So if that's something of interest to you, or you want to let a neighbor know about that, to give us a call, you can call either Andrea or Anne Marie on my staff. Both of their information is listed there. If we go to the next slide, we'd really be excited for you all to join us in a couple of weeks for our annual signature fundraiser. It's called An Evening of Oakland Storytelling, and normally we're in person, but it's going to be a virtual event this year. We're really excited about it. to be partnering with City of Asylum on this event. We're really grateful to be able to partner with them. And we have a great lineup of entertainers and storytellers. And we're very grateful to our sponsors who are supporting the event. Walnut Capital, UPMC, Next Tier Bank, and PNC Bank. Lots of other partners, the Carnegie Library, WESA, WYEP, and Storyburg. So it'll be a really fun event. Even though we won't be able to be together in person, we do hope that you join us. The registration page is live on our website now, so please go and register for the event. Buy a ticket, and the proceeds of the event go to support OPDC's programs in the community. So we really appreciate your support and look forward to having you join us that night. Next slide, please. A couple of other things just to know about. If you're looking for information about Oakwatch, there's a section on our webpage that has the meeting minutes and the next meeting. Oakwatch is taking August off, so the next meeting is in September, on September 16th. The Oakland Neighborhood Plan is continuing to move forward, even virtually. So working with city planning and the plan steering committee to launch the action teams, hopefully in the next month or two. So please go to this page on the city website to, there's a Google form there where you can sign up for an action team that you would be interested in participating in. There are 4 different options, and that's really the way that most of the content of the plan is going to be written, is through the action teams. So if you're interested in development or community, mobility or infrastructure, those are the broad categories. There are descriptions about that on that website. Also give us a call if you have questions and want to know a little bit more. But that is going to be happening. City planning has been figuring out a way to convene the action teams using virtual platforms. And so we'll be getting a lot more information out to people about what that's going to be like. But please sign up now, because then you would get the email notifications as things start getting going. And just a reminder there about some dates for if you wanted to do a mail-in ballot for the fall election. So it needs to be received by October 27th. Next slide, please. I think that's it for our updates. And now we'll start with our first presenter. And we have Martin Busser from Indovina Associates to present the project, which is a parking garage at the Pittsburgh Technology Center on 2nd Avenue. So Martin, I'll turn it over to you to give a presentation. And then, like I said, we will all moderate questions and verbalize those questions for you to answer as I'm seeing them in the chat.
Thank you, Wanda. As you said, my name is Martin Busser. I'm with Indovina Architects, here to present a 3rd parking garage at the Pittsburgh Technology Center. This will be the final parking garage to be built at the Pittsburgh Technology Center. I believe, I guess before I get started, I think there's also some representatives from the URA on the line as well. They are the lead developer for the project in association with Hitachi, who I believe is listed as the current landowner where we will be building this garage. We've done a demand analysis for the parking that is needed in the technology center. That also includes all the future developments, and we've come up with a need for about 600 parking spaces to meet the rest of the demands that are currently needed, plus any future development of the technology center. And as I started off saying, that will meet all the demands for the technology center and will be the final parking garage constructed on that site. The image on your screen gives you an idea of where the building is located. I believe this is an older map of the technology center. It doesn't loop back to 2nd Avenue as shown there, but this does show the relationship. On the next slide, we are showing some of the contextual photos. The top left photo is standing on Technology Drive, looking back towards the the first parking garage built on site And you can see the surface parking lot in the foreground. Throughout the photos, you can see the kind of surface parking lot that exists between Technology Drive and 2nd Avenue. And this is our proposed site for the new structure. The next slide. This shows some of the zoning information. This is the SP1 Specially Planned District of the Pittsburgh Technology Center. The maximum building height is 90 feet for buildings in this zone. The minimum height for a parking structure is 3 stories or 45 feet. The Technology Center is also follows the guideline of a land development plan. So those are a specialty plan that's developed by, in this case, the URA, and is filed with zoning as to different things that can be done on the site. One of the things that we found was that the maximum height for a parking garage in this area was 60 feet and 5.5 stories. However, that requirement allowed for 3 stories of office building to be built on top of a parking garage. So we are just going to modify that to allow us to go up to 90 feet. That's already permitted for a building in this area, with 7 stories of parking to allow the garage to fit on this site and meet the 600 car count that we're looking for. A couple other things to note there, we're going to provide 60 bike parking spots, and then the overall footprint's about 32,000 square feet. So the next slide. This is our basic site plan. So you can see how the garage pretty much takes up that entire existing lot. The ground floor will be dedicated to Hitachi, as the surface lot is now. And then the upper stories will be leased out primarily to other users within the Technology Center district. So there's 2 different access points to the garage you can see there. One primarily for Hitachi and one for all the rest of the daily users. The next slide. This is our building elevation along Technology Drive. We're trying to do a light frame to kind of pick up on the queues already set up by their parking garages that are down there, using some metals and things like that so that it fits within the context of the Technology Center. This slide here shows the main building entrance on the left to the upper stories, and on the right shows the entry for the Hitachi users. So the next slide is the building elevation along 2nd Avenue. We wanted to find a way to break this up since it's such a long facade and seen by people on the parkway and things like that. So again, we're using kind of that light frame, and then where you see the solid black is a mesh panel. The next slide, this would be the elevation looking from the east back towards the garage. So you can see a stair tower on the left, wide open glass as much as we can. And then you also see the open parking garage and the metal mesh in between. And then the next slide shows the elevation on the west side of the building. This will be directly adjacent to the existing parking garage on site. But again, stair tower that's as much glass as we can to make it feel as open and safe to the users as possible. Next slide. This shows some of our material. It's a mostly precast garage, a light precast and a dark precast. And you can kind of see a glimpse of the metal mesh panel there on the top left that would cover those areas that read darker on the image. The next slide is our 3-dimensional rendering. This is looking back towards the garage. You can see the existing garage in the background on the right, and the Hitachi office building across Technology on the left. And then the nice stone monument and grass area at the Technology Drive entrance there off 2nd Avenue. Again, trying to have a nice open frame here for the garage. Where you see it a little bit more solid is that metal mesh. And then you can see the glass stair tower and also glass-backed elevator. Again, trying to make things as open and transparent as possible for the users. Another thing that you'll notice with this garage, this rendering shows fairly well, is that there's a frame around the entire top that we are using as a support for a solar array. So one of the things that we would like to do and are investigating is creating an entire solar roof for this garage to take advantage of that. Those panels would all face towards the river, towards the south. And the next slide, I think, is another shot here, standing on Technology Drive, looking down Technology Drive to the west, again, kind of focusing on the stair tower, glass and open, and you can see the existing parking garage there in the background. And I believe that is the last slide. So I'm more than happy to take any questions anybody might have.
Okay, there are several questions in the chat. There was one on Facebook I will address. That somebody mentioned, you know, what about a grocery store in Oakland? That's not pertinent to this presentation, but again, I would point people to the sign up for action teams for the neighborhood plan, because the development action team would definitely be the group that would be addressing that. So then there are some questions about, I think it might be useful to go back to the slide about the zoning requirements and explain a little bit more clearly the zoning requirements for the approval of something at the Technology Center and how the zoning works. So it's a specially planned zoning district. And if that's what the SP stands for. And if something is consistent with a plan, essentially, that means specially planned, then it can be approved by the Planning Commission. So Martin, if you want to explain that a little bit more, there was a question in the chat.
Sure, yeah.
Exactly what approval is required and exactly how that works.
Yeah, this is one of the little bit more confusing parts, but essentially the garage fits all of the criteria as defined in the City of Pittsburgh zoning. So that's where I'm saying on the top of the screen here, you can see that any building in that particular site is allowed to be 90 feet in height based upon the zoning verbatim with the City of Pittsburgh. The rest of the Technology Center has a governing document called this land development plan. In that land development plan, parking garages on this site are limited to 60 feet in height. However, you could still add another 30 feet on top of that parking garage if you wanted to put a different use there, like an office or something like that. So we are going to present a revised land development plan to zoning saying that we would like to have more stories and more height to the parking garage, but still fall within the restrictions and guidelines of the base zoning district. So this is something that we work through directly with the zoning administrators. And so far, it seems like this is something that would be accepted, but we wanted to make sure that everyone was aware that there is a little bit of an ask from the City of Pittsburgh for this particular thing. That is the only item of this garage that doesn't meet all of the guidelines verbatim.
There's a question about what is the total number of parking spaces at the Technology Center with this garage added?
I do have a document here. I should take me a second to find it, but I believe with this garage added, it's around 2,100 parking spaces.
And have you been required to do a traffic study related to this parking garage?
We have. Our traffic study is complete. Our demand analysis is complete. The demand analysis tells us that 600 cars is the right number for this. And the traffic study is currently being reviewed by DOMI, but all sites seem to think that everything will be okay without any major improvements necessary.
There's a lot of the attendees tonight live in the Oak Cliff neighborhood, which is the bluff that's above the Technology Center. So they're interested in what they would be looking down upon from their neighborhood, and noise from things that are placed on the roof of the structure. So can speak to that and show a slide that is the best slide that would show, are there any HVAC units or other mechanicals that are going to be placed on the top of the building? And can you describe those? And can you describe the noise impact? And have you done any noise studies related to them?
So the very nice thing about this garage is that we are going to tie it into all the existing systems. So we don't need to add any office space or anything like that to run this garage. It's simply a structure. There's only two small condensing units because of the elevators. Their hoistways require air conditioning. These are very small units. They'll be sitting on the top parking deck. You wouldn't see them. You wouldn't hear them over all the other noise that's already out there. The biggest mechanical item that we are looking to add is the solar array that I spoke of at the top. So when you look down onto the site, you would actually see a roof, essentially, a roof of solar panels. And again, those would all face away from that district. So any glare, anything you have wouldn't, from the sheen of the solar panels, would not go up that direction. It would be bounced back towards the river. But you know, that's one of the great things about this project is we can do a lot of sustainable items and don't have to add any mechanical units because we don't need it. There's no human occupancy for the garage.
We have a question. Can you be more specific about the condensing unit size?
Oh, the condensing units are very small. They are typically 1 foot wide by 3 foot long by 2 foot high. They have one small fan in them. They're just designed to cool the elevator equipment in the hoistway.
And Kathy, if you could move to the slide that shows the 3D rendering, I have a request to look at that again. And then there's a question about height here. So, and I think we do need to go sort of back and forth on some of this approvals a little bit more. There's still a lot of questions about exactly the approval process and your argument for getting more height.
Okay.
But I guess here's a way for people to see the solar array that you're talking about, unless there's a different picture that would be better.
No, I mean, this shows what level it's at because it basically gets supported by that top band of concrete that you see. It doesn't stick above that. I see right there, somebody's asking if the solar array is above 90 feet. The solar array actually is at 85 feet, I think, at the moment. So that's way up there. If we didn't have the solar array, the garage would probably be around 70 feet, 74 feet. But to get that solar array up above the top level of parking, obviously we need the room there and essentially building a roof on top of the garage.
Okay, so then there are a couple of transportation study related questions. And I don't know, to the extent to which you're familiar with the traffic study for this project, how does it fit within SPC's Second Avenue corridor study that was completed last year? And what TDM measures are being taken to reduce single occupancy vehicle trips to the site?
So I was just trying to think through these things. At this moment in time, that traffic study that we created for this garage is being compared to those other studies through DOMI. Our traffic study said there was very little added impact from this due to different trip times and things like that. So I don't believe there will be a major impact from this from this extra from these extra spaces. The second part of your question there is something that we are working through with the development team. We are applying for a Park Smart Silver certification. I probably should have said that earlier, apologize. Park Smart is an equivalent to LEED. I think a lot of people are familiar with LEED. It's very difficult to get a parking garage LEED certified because of the lack of mechanical equipment and things like that. So there's now in the past few years, a specialty way to rate parking garages on sustainability. And those measures that you asked about are part of achieving those points. So we are working with the development team to plan programs and things like that to promote less single vehicle traffic. And that also is in conjunction with the PTC owners themselves.
It would have been helpful to have more information about the traffic study in your presentation.
Yeah, I apologize. That's not my area of expertise. I'd have to get the gentleman who did that on here.
Yeah, well, and it was something, just so people know, it was something we requested information about. So there's more questions about, you know, can you talk about how the parking garage will contribute to quality pedestrian environment along 2nd Avenue? And are you designing the parking garage so that it can be converted to non-vehicular use in the future?
I have my own philosophy on that second question. It's very difficult to do that because of all the ramping that's required in parking garages. You have to do a lot of retrofitting to make it something different in the future. The foundations and the structure and everything that are there are certainly capable of handling a different type of building in the future. I apologize. What was the first part of the question?
Can you speak to the quality of the pedestrian environment along 2nd Avenue?
So we are working with our landscape architect to create a nice greenery between the garage and 2nd Avenue there. We haven't noticed too many people using 2nd Avenue while we've been on the site going in that direction on this side of the road. Seems most people cross over to the bike trail on the other side. We are adding a walkway from the garage down to the bus stop at this area to just add some more sidewalks and pathways for people to traverse around the technology center.
And can you speak to the what the traffic study says in terms of accessing this parking garage from the parkway and the additional traffic at Lower Bates from the parkway ramps?
Again, I'm probably not the right person to talk about those things. I just know that all the information we gathered appeared to not impact what was already in place.
And there's a question about if you could explain again what the argument is for going from the approval, what is allowed at 60 feet, and then why the 90 feet is requested or required.
So in order to get the car count, to get the parking spaces we need the extra height because of the size of the site. If we don't have the added height, then we don't have enough parking spaces for the technology center, and we would essentially have to build another parking garage. So we don't want to do that. We want to let the technology center have land area for other structures and things that are more pertinent to what the technology center is made for. So this is designed and planned and sized to be the final parking structure on that site.
And then there's a question about like whether there would be any other architectural features on the building that aren't shown here.
No, this is what you see is a precast concrete with vertical aluminum detailing, some aluminum rails, the metal mesh, and glass. Again, we were trying to keep it simple and clean to fit in the context of the other parking garages on site and kind of the clean nature of most of the technology center architecture.
And there's a question about the overall plan for the technology center in terms of additional built out of square footage of commercial space and how that relates to the existing square footage today. I think you've answered the question of the 600 spaces in this garage are intended to cover that existing build out for future development of other parcels for commercial space.
That is correct. I can't speak to what other plans may be in the works for the technology center, but again, the 600 spaces is what is needed to make the entire development work.
Okay. And is this garage related to any, like, are people today parking off site because there's not enough parking capacity at the technology center today?
I do not know the answer to that question entirely.
Okay.
I think my traffic engineer might be able to answer that with the information that they gathered.
And then it would be good to describe who's going to own and operate this. You have listed on your slides the URA, but they typically don't operate garages. But are they?
Yeah, so they own them often, and then they employ an operator to run the garages, or then sometimes they will sell them off. I believe the garage in the background here, they actually sold to Hitachi a few years back, but prior to that, they owned it and had another company like Alco or somebody like that manage the garage. I don't believe they've put out an RFP yet for people who would actually manage this.
Okay. And can you speak to the amount of surface parking spaces on the technology center that this is replacing?
So the lot that this is going on has 88 parking spaces in it. So we're essentially adding 512 parking spaces.
And timing for your approval process?
So our plan is to go to bid to contractors in December. As we're moving through the approval process, we are planning to have that in hand in February and then starting construction in March.
So planning commission, when?
That would be later. That'd be later this year in November and December.
Okay. I think that is most of the questions in the chat have been covered and on Facebook. So thanks everybody for participating and the active nature of the questions. I appreciate that. We could now allow those who are on the phone only and unable to access the chat feature. Looks like there might be 2 or 3 people in that category, according to my view of the participants. So at this point, if that applies to you and you have some question that hasn't already been answered, you can unmute your line and verbalize a question. Hearing none, I think we'll wrap up this presentation. We would We do have a project page for this on our design and development review page of our website at opdc.org. I would encourage everyone attending tonight, and even those who can't attend, and if you talk to somebody, they could see the presentation on that page on our website. And we'll have a form there to provide input. So if there's additional thoughts that you have, additional questions that you think of later, you can use that Google form to provide input. And then if you also just want to kind of let us know what you think about it, OPDC will gather that information and report that back out on that same project page so that we can then show, what community feedback we received about it. And then we can send that to Indovina and the URA so that they have that. If there's additional information about the project that we receive, would be great to get the traffic study, and we could post it on that website and let people know that that's there.
Yeah, I'll be happy to share that with you once we get our comments from Domi and understand what their thoughts are on it, and we can certainly share that with everybody. I wouldn't want to share that before knowing what Domi's comments may or may not be.
Great, and I didn't mention exactly an instruction for if people are on the phone how to unmute. You can hit *6 on your phone and it will unmute your line. You can also indicate that you'd like to ask a question by hitting *9. And that kind of raises your hand to us who are moderating the meeting. So I'll give another 10 seconds in case that was helpful for anybody and they wanted to ask a question. Again, hearing none, again, please go to the page on the website. We'll have the meeting notes there. The presentation exists there now. There's a feedback form. And now we're going to turn it over, I think it's to Owen Cooks from the University of Pittsburgh to talk about the new railings that will be installed at the Cathedral of Learning. And any speakers from the University of Pittsburgh, please turn on your video. It is much more helpful to be able to see presenters actually speaking. So anybody who is from the University of Pittsburgh who's going to be presenting, you can turn your video on.
Good evening, Wanda. This is Mary Beth.
Hi, Mary Beth. Sorry, I wasn't sure who was speaking. So
yeah. So clearly I'm not Owen, but thank you. I'll be presenting tonight. Good evening, everyone. I'm from the University of Pittsburgh and work as the Associate Vice Chancellor of Planning, Design, and Real Estate. And tonight I have a short presentation to you regarding the Cathedral of Learning. I'm sure you're all familiar with it. It's our 535-foot high cathedral designed by Charles Clotter back in 1926 and was commissioned at the then Chancellor by John Bowman. So around the cathedral on the walkways, there are a number of stairs, and these stairs are not easy for people because many of them have old railings or no railings. And there's a dashed line around each set of stairs that we are replacing. And as required, this goes before OPDC staff before it goes to historic preservation. So you will see a number of dashed lines, and let's go to the next slide. So this is, I think the photographs give the best image. This set of drawings is around the cathedral, and you can see there are steel rails there. They will be replaced with wrought iron rails, which is keeping in the character of this Gothic structure, or Gothic revival structure. There will be handrails with an inner scroll that allows you to keep your hand on it at all times. There's a post that's a twisted wrought iron, and the little ring is called a port ring, and they will all be set in the existing stone. So this particular drawing It's hard to see the numbers, I know, A2. Those are on the 5th Avenue side of the walk. Next slide. And this set of drawings is our stairwells looking down into the Stephen Foster Memorial. That's on the south side. The photograph on the far right is just shows you that that twisted iron is in keeping with the historic nature of the cathedral. There are temporary railings there now, and those will be replaced with wrought iron. They will go in the joints if you're interested in the details rather than through the stone, so we can preserve the stone. Next slide. And this area is around Hines Chapel. Oh, did you go a little bit further than that? These are details of the railings. I think we might have missed a slide, but there are also steps around Hines Chapel. There are a few going up into the chapel and just a couple of steps on the side, but these are there both to keep in keeping with the historic nature of the cathedral, but also to make it easier for people and the general public to walk around the grounds. And that is really the end of my presentation. So there's the ones that are with Hines Chapel. It's not a large step, but still, it's much easier for people if they have a railing. I'm happy to answer any questions.
I'm just looking at the chat. There's one question, Beth, about do you worry about vandalism to the railings, like skateboarders on low walls?
Not so much to the railings. They're rather thin. We do have some security around the campus, but it's not a huge concern.
Okay. And there's one question to go back maybe to the overview map, and I don't know how we'd actually point to the locations, but I guess people just would like to know a little bit more of exactly where on the site these are going to be.
Yeah, can you
don't have the cursor to be able to point. Kathy can, or she could zoom in here, and I think she's trying to.
Yeah, there you go. You can see those. With the dashed heavy black line around them are all the areas where we are replacing or adding a railing. And there's the Hines Chapel, and those are the stairs that will have a very thin railing.
Okay. And then there's other, I think just other thoughts that people are talking about, again, the potential for skateboarders to ride on them and, you know, that kind of thing is a comment I see in the chat.
Yes, that would be most unfortunate. I suppose we can always add things to the railing as we do on our stone when that starts to happen. It's not great to grip a rail with those clips on them, but I understand the concern.
And I'm sorry if you already said this, but could you go over again the process, like when you're scheduled for HRC? Just in case people didn't hear that before.
Yeah, I'm not sure of the date yet for HRC, but I can certainly get that to you.
Okay, so you don't have it already maybe on the agenda, or?
No, I don't believe so.
Okay, all right. Yeah, if you do have that, then we can add it to the project page. And just so people know, these are, if you want to take a look at them a little bit more closely and do the zooming in that Kathy's doing now, you can access them on our website. And I'm not seeing, let's see. I'm not really seeing any other questions in the chat. There's lots of comments about the, that it's maybe slightly difficult to see the presentation materials. And so, yeah, I appreciate that that's the case. Otherwise, I'm not sure there are any other questions. We do have this similar kind of feedback form that we described with the last presentation. So if people think of something later and have a question about it or want to provide some additional feedback, if somebody that you know wasn't able to attend the meeting and they would like to provide some feedback, there is a feedback form, and we'll gather that information, consolidate all of those responses, and post that feedback back to the same page so everybody can see the input that we received. And then when you do have the HRC date, we can also put that on the website and send that out as well on the next e-news that we send.
All right.
And then again, for those who are on the phone only, you can hit *9 to raise your hand if you'd like to indicate that you are interested in asking a question. And you can also just hit *6 and you'll become unmuted and you can ask a question. So we'll allow that now. Okay, hearing none. Thanks, Beth, very much for presenting this.
You're welcome. Thank you very much.
Now we're going to move on to Paul Sepowitz from the University of Pittsburgh to present the plan for their plans for students returning to campus. So Paul, I'll turn it over to you.
Yep. Thank you very much, Wanda, and thank you for giving us the opportunity to present today's meeting, and thank you, Kathy, for your help in getting these things together. I am going to just give a really a quick overview, and then I have two other colleagues who are with us who can really provide information and details on the plans involved in the return of our students to campus. That is Kenyon Bonner. Dr. Kenyon Bonner is Vice Provost and Dean of Students, and Dr. Christopher O'Donnell is Associate Vice Chancellor for Special Projects in the Health Sciences, amongst other positions as well, and roles at the University School of Medicine. And so I appreciate their time and efforts in being with us tonight. So with that, like I said, I just want to try to provide a quick overview, and the university's plans for returning to campus are really a resilience framework that is intentionally responsive to the larger events or conditions around us. It is, it establishes 3 different operational postures: high, elevated, and guarded, and you'll hear a little bit more about that, excuse me, but all in our effort to support health and safety while being able to continue our mission. So the plan's flexibility enables us to respond to changing pandemic conditions. For example, the hybrid approach to teaching, called Flex at Pitt, leverages technology to enable both in-person and remote learning. It's built to work regardless of who is or is not in the classroom. And, as a leading health sciences university, we are fortunate to be able to leverage our access to experts in infectious disease, virology, epidemiology, and medicine. And that's what we've done. Early in the pandemic, we established a healthcare advisory group composed of experts in the, in those areas. And the healthcare advisory group has been charged with recommending university-wide health standards and guidelines to enable us to live and work on campus. And we'll continue to monitor the health status of the campus and environment, and we'll align the university status to be coordinated in our policies with the city, county, state, and beyond. we also recently created COVID-19 Medical Response Office, which Dr. O'Donnell, who's with us, has a prominent role in leading. We use testing, modeling data, public health guidance, and the latest science that will shape our operations as we move forward. So that's kind of my quick overview. At this point, I'd like to really hand off to Christopher O'Donnell, who can talk to us about, as I said, Christopher is part of the leadership of the COVID-19 Medical Response Office, and thank him for taking the time to be with us.
Thank you, Paul. Wanda, I don't have any slides, so you can make me big if people want to see me. That's fine.
Okay.
So you're doing a masterful job moderating this session. I've been in hundreds of Zoom meetings in the last few months, and not many of them have gone this smoothly. So,
Well, that's nice of you.
yes.
Would you prefer that we just stop sharing the screen then? And
Whatever people want,
okay.
I'm not going to use slides, so I'm going to talk for about 10 or 15 minutes. So,
Okay. Yeah, I think that's actually helpful to be able to see the speaker a little bit better. So we'll do that now, and then we can go back to your slides when you're ready for them.
Sure.
So if people want to choose speaker view, you'll just see the speaker then.
Okay, let me just. Okay, thank you, and nice to meet everybody, and appreciate the opportunity of speaking to you today. Let me begin by introducing myself a little bit more. My day job, I am a scientist. I'm a PhD, not a physician, and I work in the area of sleep. So I'm not an expert in virology or epidemiology. And if you have questions at the end about sleep, I can probably do a better job of answering those. As Paul mentioned, I have a role in the recently formed COVID Medical Response Office, and I'll talk a little bit more about that in detail later. You probably notice I've got an accent, and if you're on speaker view, you'll probably see a Kiwi on my back wall there. That's because I'm originally from New Zealand. I've been in the US for 32 years. I've been in Pittsburgh for 16 years, and both of my children went to the University of Pittsburgh and had the pleasure of living in Oakland and amongst the community for several years too, and had a wonderful time. You probably are thinking, well, maybe they brought this guy in because New Zealand's done such a good job of eliminating the virus. That's actually not the reason that I'm here, but it is worth mentioning that the strategies that New Zealand used to control the virus were essentially threefold. The first was a very regimented mitigation system, which was essentially sheltering in place. They didn't use masks in any particular way like we are at the moment. It was really all about a shelter in place strategy. They had a lot of accurate and fast testing so that when there was an outbreak, they could jump on it very quickly. And they had a Prime Minister, Jacinda Ardern, who hopefully many of you have heard of, who ran an incredibly good communications plan that got the whole country in sync on this. And we're going to revisit these themes later on with respect to the plan for Pitt, because they're all relevant features. So how did I end up in this role? I've sort of cut my teeth a little bit earlier in the pandemic. Even though I'm a PhD, I'm active in a clinical department, and I watched mainly from the sidelines the efforts to get UPMC up to speed and organized to deal with COVID back in March and April, when really no one knew what we were getting into. And I can tell you at that time, there was an enormous amount of angst and fear, honestly, amongst healthcare workers. So I'm here today to say that I understand that a lot of the Oakland residents are going to have angst and fear, and it's a perfectly normal response to the situation that we're finding ourselves in. The next step I took in this sort of COVID world I'm in was helping in the restart of research on the campus. This happened in May, early June, and we spent a lot of time writing guidelines and thinking of safe ways of bringing the researchers back to do their day jobs, involving masks, social distancing, de-densifying, all the things that you've heard about. And I can tell you again, there was an enormous amount of angst and fear among the researchers when they came back to work. Now we've been back at work for a month or so, and we're not operating normally, but there's a lot of shift work, and people have really been abiding by the mitigation protocols we've got in place, and everything's settled down, and there's sort of a calmness now, and people are going about their work. I am hopeful with regard to Pitt and its Oakland community that eventually we'll get to that same place, but I understand right now there's a lot of uncertainty, and we have to deal with that, and we have to plan for that. So where are we right now in terms of Allegheny County? Well, as everybody's aware, we've had what we can call a recent surge over the last few weeks. And that's been predominantly attributed to younger people going out, either traveling or in Allegheny County going to bars and not social distancing and not wearing their masks. And that's led to, you know, a significant surge in cases. I personally think that we may be lucky that this has happened, because it's going to provide a little bit of a wake-up call to the younger generation. And even though this has been a large problem across the country, I feel that if this had have happened with the restart of, you know, the school year in August, it could have been on a much bigger scale. And I think our younger people now have a little bit of a reality check on what's involved in trying to mitigate the spread of this disease. So I'm hopeful. We'll obviously see what happens in the future. In terms of where we are now in Allegheny County, things do seem to be leveling off, maybe trending down a bit. So, you know, we could be in a much more favorable place, you know, 2 to 3 weeks from now when we welcome the students back onto campus. The UPMC hospital system, it does have more patients than it did in the sort of the May, June sort of height. But they're still in a really good space. They still have a lot of potential occupancy. So in terms of that aspect of it, we're in a relatively good space. When we look at the prevalence, the UPMC has been testing, I think it's now as many as 25,000 asymptomatic people coming in for elective surgery. And the rate of infection, which really reflects what's going on in the county as a whole, is pretty low. It's about 1 in 400 amongst asymptomatic people coming in. So in a lot of ways, I feel sort of that we're in a relatively stable situation compared to a lot of other places. It's not as perfect as it was 5-6 weeks ago, but I still feel we're in a good space. And I think the other lesson here is that we really have to learn to coexist with COVID in Allegheny County. It is not going away anytime soon. I know we're all hanging out for a vaccine, but a vaccine's not going to be a magic bullet. I mean, the soonest it's going to be here is probably early next year, and we have no idea how effective it will be. And if it is like the flu vaccine, you know, that's about 50% effective. So we're still going to have to manage COVID. We're not going to wipe it out of our system. So we have to learn, you know, the ways to get on with our life and to deal with this. So I've got some notes down here. So how has Pitt been preparing from a medical and a scientific perspective for the return of students to campus? Paul sort of briefly outlined this. So that the Chancellor tasked the new Senior Vice Chancellor for the Health Sciences and Dean of the School of Medicine, Anantha Shaker, to form an advisory group. And this group has been working for several months, and they have been creating standards and guidelines around sort of every aspect you could think of related to COVID control. You know, for example, how is housing going to work? How is travel going to work? Many of these things. They've created a lot of documents that have been generated by this group of very talented people. They're a mixture of epidemiologists, virologists, physicians that work in this sort of area. And in my more recent role, I've been sitting in on these meetings, and I've been just really impressed with how thoughtful they are. Now, those are guidelines and standards that are written down. But we all know that just writing something down is the easy part. It's how do we operationalize it? And so this was where my first role came in, when the Dean of the School of Medicine decided to create what he called an Implementation and Oversight Committee. Some of those members on that first committee that made the standards and guidelines morphed into this second committee. And we've sort of been working in parallel saying, okay, this is what you've suggested we need to do. How do we make that work? And we've sort of been doing a little bit of backwards and forwards and refining that. That's been going on for about 5 or 6 weeks. On this implementation committee, we've really had 2 groups. We've had a group which we call our medical sort of subcommittee group, and they're really focused on that hardcore science of testing and contact tracing and all those details. And then we've had another group that we call our behavioral subcommittee. And this is full of behavioral psychologists, behavioral economists. We have student representatives. And between the 2 of us, we're trying to figure out how we can have mitigation and containment strategies that really have a chance of working. And so we're meeting, you know, every second day. There's 1,000 emails going in every direction. And, you know, I just want to say that there's sort of hundreds of people working on this, and there's been a lot of progress and preparation. Now, the third part of the preparation was this new office that Paul mentioned at the beginning, which is called the COVID Medical Response Office. And this was tasked by the Chancellor really only about 3 or 4 weeks ago. And I'm one of the 2 leaders of this. It's a small office at the moment. We're sort of gaining momentum. And our goal is very much more strictly around virus control on the campus. I'm in charge of operations, and the director is John Williams, who's been on all the other committees. He is a respiratory virologist. He does a lot of good epi work. He's very up on testing. He's a super guy, and he's absolutely perfect to lead this charge, because we've got a lot of moving goalposts, and we've got very short timelines. So those are the sort of the 3 committees that we've set up, and it's sort of been a narrowing of focus as we sort of hone in on when the students come back. Now, as Paul mentioned, we are a health education campus, and so we have to have a certain amount of in-person classes. We're teaching medical students, we're teaching dental students, nursing students. We do a lot of research. And so Kenyon will probably talk about this a little bit later, but Pitt has put together a really good plan, which they call Flex at Pitt, that allows a combination of in-person type programs and also remote type programs. And this is why we need students on campus, because we have to prepare them. They're going to be interacting with patients, and we need them to learn to do that safely. And that stuff just cannot be done remotely. So that's sort of the rationale behind what we're doing. And probably the next issue is, in the big picture, what are all the other schools doing? How do we fit in with their programs before I get into our specific details. What I did in preparation for this is went and reviewed the top 50 academic medical centers, which means it's a campus that's associated with a medical center, very much like Pitt is. And these are our sort of peer groups. We went to the top 50 ranked in the country. We're ranked in the top 10 and said, what is everybody else doing? Well, I can tell you it is all over the map. You've probably heard that some schools are going to test everybody before they come back. And I'm going to talk about why we don't think that's a good strategy in a few minutes. There are some that are only going to test symptomatic students, which is a good approach as long as you can do it quickly. And obviously all of them are going to do the standard mitigation, masking, distance, that sort of thing. The really heavy lift in terms of mitigation is sheltering or quarantining. This is exactly what New Zealand did to completely eradicate the virus. Now, they could shut their borders and completely eliminate the virus. We are not going to eliminate the virus by having a quarantine shelter-in-place program, but we can really make a difference. It's a very, very important strategy. And as best I can tell, the only two places I can find that are doing a 14-day shelter-in-place or quarantine protocol is ironically us and CMU. So in terms of being in the Oakland community, I think it's great that you've got two universities that are attempting to try and do this program. And I know you're going to have a lot of criticism. There's going to be a lot of issues about it, but we really feel it's worth making the effort to try and do this properly. So let's talk specifically about what is Pitt's virus control program. And I can tell you that when the Chancellor decided to form this third tier office, this COVID medical research office, he called in John Williams and myself, and he said, I want science and medicine to control how we bring this campus back to life. He said, I know that you're going to be working within constraints of, well, this is when students are scheduled to come back. This is how they normally come back. This is how the housing works. This is when the classes start. He said, I want you to throw all that out and say, they're going to have to adapt. What do you want to do to bring students back in the safest possible way? And so that's the plan I'm going to present to you today. And it's continually being refined. It's still a work in progress. So the number one thing that we're doing around mitigation. So let me take a step back. So the two main things that we use in virus control are mitigation strategies and containment strategies. And I'm sure you've heard of both of these terms. It's probably simplest to think of mitigation as really population-based behavior that stops the spread of the virus. And the containment strategies are what we do as individuals once someone gets infected. So I want to first talk about mitigation strategies. And of course, we will be promoting all the things that all of us know about now. The wearing of face masks. Pitt will be providing 2 cloth face masks to every student returning to campus. There'll be social distancing. We're de-densifying the dorms through use of hotels. We are going to have a whole education campaign around, you know, the whole social distancing, the hand washing, everything. It's going to be all over the campus in every form possible. The big lift, as I said, is we're attempting to do what is effectively a quarantine, but we've tried to avoid that word because it has sort of harsh, sort of negative connotations. And we really want our students to make as much effort as they can to do this well. So we're calling it shelter in place, and then we're calling it pod week. And how does it differ from quarantine? It's a little bit more flexible, and it allows for socialization, which let's face it, that is the main reason, one of the main reasons that the students desperately want to come back to campus. So instead of telling them they have to stay in their room for 14 days, we have created pods, which are basically going to be physically rooms near each other of about sizes of 4 to 6, where they can interact as a group during this shelter in place when they're on campus. And that becomes their group that they can go out and get food, come back, they can eat together, they can go out and exercise together, but we don't want them to interact with any other pods, particularly in this pod week phase. And to make it even more palatable, we've split the 14 days for a lot of students. It can differ depending on, you know, if you live on or off campus. But for those that are going to be living on campus, we've split it into shelter in place at home, safe travel, and then pod week, which is really shelter in place at the university. And would it be better to do 14 days quarantine? Sure. But all our behavioral experts, our students tell us the program won't work if we make it that harsh. And having the 7 days either side with what we're calling safe travel in the middle, I think is the best possible option. So many of our students can travel safely because we have almost 70% of our students live in the state of Pennsylvania. So they can quite safely drive just in a few hours onto campus. And so we really feel that we have a good mitigation strategy with this shelter in place. Can we control it? No, we can't. We can encourage, we can monitor, we can do a lot of things, we can give feedback to students, but ultimately the students have to take ownership of this. I think they know that it's in their hands if this campus remains open. If they come back and they're not willing to partake in these activities and we have a large virus outbreak, everything will be shut down and they will go home. So they have a vested interest in making this work. That's our mitigation strategy. What are we doing around containment? So in terms of containment, we're very, very fortunate that we're partnering with UPMC. They have rapid, accurate testing, which is not available to everybody else in the country. We're very unique, and our partnership there is going to be very helpful. So let's start with the question of why are we not testing everybody when some places are doing it? Well, the first answer to that is, if you test everybody and they get a negative test, that doesn't mean they're not infected because of the course of the viral load relative to when the testing's done. So there are going to be a number of false negatives. So that's the first problem with doing it. The second one is it's probably not going to work from a pragmatic point of view. So at the moment, in the United States, we have about 30% of the daily testing is done by one company, one commercial company. And I can tell you at the moment that that commercial company already has close to a 7-day turnaround. And they can administer 110,000 tests per day. When students come back to university, amongst all the universities and colleges in the United States, there are 20 million students. Now, they're not all going to come back to campus, but even if a proportion of those have to be tested on this large scale, the system is not going to be able to cope. Sure, they'll sample, they'll send the tests to these companies, and they'll get their results back 14 days later, which is going to be medically meaningless. So there's two reasons that we don't want to do it. The first is that we tax a system that already doesn't have enough testing, and we're going to take tests away from people who are symptomatic and need it immediately. And secondly, even if we could do it, we're probably going to get results that are not helpful. And then the last point I want to make about this is we do not want students to have a free pass. You can imagine a situation where students arrive on campus and they say, hey, I tested negative. Let's go celebrate. You know, that's going to be the mentality. We do not want to give people a free pass that they're not going to get COVID because they don't have it now. So what we're doing instead is we really need to know what we're bringing onto campus. As I said earlier, we've got a pretty good handle on what's going on in Allegheny County with the surveillance that's going on. So what we plan to do is a systematic randomized testing of 10% of our students. And that will be equally divided between students living on campus and off campus. And that data is going to be very, very important because we are planning on bringing students back in a phased, this is particularly for on campus, in phased stages that'll be 4 days apart. So we can get rapid turnaround of our results in 24 hours, and we can have a pretty good indication of the prevalence that we have at that point in time on the campus. And based on that, we can then make other decisions. Now, we're not simply going to slow things down on that alone. There's going to be many, many other factors that come into the equation here. But it's going to be extremely helpful on giving us a handle on what is the sort of the viral state of the university. We will also repeat that several times throughout the semester so we can keep an eye on where things are going. So that's our surveillance testing strategy. The other strategy we have, which is crucial, is testing of symptomatic students. And this, again, we'll be able to get 24-hour turnaround from the UPMC system. That allows us, you know, a student comes to us with symptoms, we can test them and put them in isolation immediately. And remember that the rate of positivity among symptomatic people is only 10%. So 9 out of our 10 students who are symptomatic and turn up, we will be able to clear and send back out, okay? For those that are positive, then we can rapidly do contact tracing within the abilities that we've got. And I think we have a pretty robust system that we're putting in place. So this is our sort of containment strategy. And again, we're unique in that ability. If we had to rely on outside commercial entities to test our symptomatic patients, and they can't turn the result around for 4 or 5 days, we're going to have a very weak containment strategy. But I'm very hopeful that we will have a great system in place, and when we get outbreaks, we will hopefully be able to deal with them very quickly. So I've been talking for a long time. I didn't realize I had so much to say. I guess in closing, I would say that this is a really great partnership because we know that Oakland needs the students, and we know students need the Oakland experience. And for this generation of children, and I've got 2 children in their 20s. Now I know for most of us who've got 20-year-old or slightly younger children, we get frustrated that they don't pick the clothes up off the floor. But in other ways, they are a great generation. They care about climate control. They care about social justice. And I'm really hopeful with communication and messaging that they will be a partner with both, you know, their peers and their community in making this work. And I would also, you know, just remind you as community members that if you observe the masking, the physical distancing, and all the good things that we need to do for mitigation, it's going to help everybody. So, you know, if we both do this from both sides, I think we'll do really well together. So I apologize for talking so long, and I'll pass back to Paul.
Thanks, Chris. And to keep, I know that a number of questions have come up in the chat, but I think that I want to go, if it's okay, Wanda, right to Dean Bonner. I think some of his comments may address some of those, and then we can go to any questions after that, if that's okay. Good.
Thank you, Paul. Thank you, Chris. Thank you, Wanda, for the invitation. So I'll try to be brief, but just to touch on a couple of things. You know, there are a lot of questions about how will we manage this and to what extent will our students comply with the behavior. So I just want to spend a little bit of time just going over our plan and approach to protecting the community, both the campus community and the Oakland community. But I also want to underscore what Chris said, that, you know, to the extent that our community partners, community members also comply, I think we can all make it through this together. So it's not just our students, it's our faculty, it's our staff, and it's our community members. But to get to the point, so one of the things that we have in place for this year is that all faculty, staff, and students will be required to go through COVID-19 training. That'll be something that our faculty will be expected to do, our staff, and then all of our students, not just our new students, meaning the new 4,400 or so new students, but all of our returning students will be required to participate in COVID-19 training. And we'll be reiterating many of the things that you heard Chris talk about and the things that we've heard over the past several months from the CDC, as well as all of Pitt's policies, guidelines, and standards. So that's our first measure in terms of making sure that we're level set with education and information. The approach for the community is building the culture and then also compliance. So let me talk about the culture. The culture is this notion that above everything else, our campus is a community. University is a community. Yeah, we have many facets to it, but we're comprised of people. And our survival is really based on the extent to which we work together within this community, this sort of social contract. And so this summer, our students drafted a Pitt Community Compact, which is basically a list of behaviors that they believe and we believe as partners, all of our community members should follow and adhere to in order to ensure that we have a safer experience and we can get through this together as a community. I'm very proud of our students for taking the lead on this initiative. Our 3 student government board presidents, as well as a group of students they pulled together, drafted this community compact. That community compact has been shared with faculty and staff, as well as our regional campus colleagues. And there's a lot of buy-in to it and support for that compact. Our goal is that when students return to campus, that they will acknowledge and accept this community compact, which has a number of things that we expect people to follow. Obviously, we'll have in there face coverings in all university buildings, physical distancing, complying with our contact tracing if that becomes an issue. So all of the behaviors that we've heard of that are really important for mitigation and containment are listed in that compact. And so creating this culture in this community is really where a lot of our energy is going. But we're not stopping there. I know there are lots of pessimists that that's not the only thing that will be effective. And we agree with that. That's not the only thing, but it is a very important part of who we are and what we plan to do as a community. But we've also gone further than that. And we revise our student code of conduct. And I'll speak specifically to what we're addressing with our students as the Dean of Students. But the expectations are the same for faculty and staff. Our student code of conduct has a new policy in it that requires students to comply with public health guidelines. And it would be a violation of the student code of conduct if they are not compliant with our public health guidelines, whether they're Pitt originated or from our community, local, state guidelines. And so if there are students who feel that they do not need to comply with wearing a face covering or physical distancing or any other guidelines that we have on campus regarding gatherings and programming and spaces and space usage, those students will be referred to the Office of Student Code of Conduct, and they will go through our conduct process, which is a due process that they are owed. They have a right to that, and if they're found responsible, there are consequences to their behavior. So this is not just a feel-good approach to addressing the behavior. My hope and my goal is that our students will comply based on the culture that we're setting and the understanding that their behavior impacts other people's safety, not just our community, but the local community. But in those cases, if they are not in compliance, we do have a process to handle that. Some people have asked, what are the consequences? I can't give you a cookie cutter approach, but I can tell you this, that it depends on the behavior. And it could be anywhere from educating students to remind them, maybe some students just are not aware, all the way up to suspension from the university, and anything in between. Restrictions from buildings, restrictions from certain classes or particular activities. So we have the whole entree of things that we can do to help address the behavior. And we're very serious about that. The safety of the community is really important to us, and there's a widespread support that this is the appropriate way to handle that. So our student code of conduct will handle that. In terms of our students who live off campus, our student code of conduct extends both to on-campus and off-campus students. We are taking this approach on campus. We have a number of sort of guidance documents that will help people understand how they might respond in certain scenarios. We are not calling the police as a first response to public health issues, such as a person not wearing a face covering. That is a philosophy and an approach that we feel very strongly about on our campus. I do as well, and our students do also. So we can handle most of these issues internally with faculty, staff, and students being active bystanders and addressing these behaviors and referring them to the appropriate offices. As for off-campus students, I am not going to tell you what to do as a community member in terms of calling the police. I'm just underscoring that on campus, the police are not the first call. But we also recognize that there are lots of behavior that we may not see in Oakland or the Oakland community. And so our Environmental Health and Safety Office has a report of concern form that anyone, both on and off campus, can report to us, and we will follow up. As much information as you can provide your email address, or it can be anonymous. And as we get this information, we will use that information to follow up with students and, as appropriate, address their behavior through our formal processes. And I encourage you to help us with that. If you see a party that's happening, give us as much information as possible, and we will follow up and do our due diligence to find out if students are responsible for that. If you decide that it's in your best interest to call the police, that is your decision. And then working with our Pitt police, they will inform us of any students that may have been involved, and we will follow up with those students. The other thing I wanted to mention before I stop talking is that the different operational statures or postures that we're in, one of the criteria for determining where we are, whether we're in high risk, elevated risk, or guarded risk, is compliance. And so every week we look at the number of student complaints we've received. We'll look at that from our police. We'll look at that from our student code of conduct office. We'll look at that from our community. And we will use that to determine whether or not we need to remain in a certain posture, move up into a higher elevated posture, or to a lower elevated posture. So all of these things matter, and they are calculated, and they're important to the fall semester. So all of our students are, our student leaders are on board with helping us to market and promote this campaign. Tomorrow we will be releasing this information to all of our students via university-wide communication, as well as a video message from me and our student leaders who helped draft the campus compact. My goal is that, and this is just my experience with our students, yes, with any community, you have folks who struggle with some of these guidelines, but I do firmly believe that virtually all of our students are committed to being here in the fall. They understand that a lot of this depends on their behavior. The faculty and staff also understand that, and I'm very confident that we will have a semester in which our students will comply and support and work and behave in each other's interest. And if and when they don't, those few, we will address that behavior, and we will not tolerate behavior that endangers the lives and health and safety and well-being of others. So I'll end there, and I guess open the floor to questions.
Thanks, Kenyon, and Wanda, I'll turn it over to you to moderate there, but just say that we'll get you, for example, the EH&S address to submit or report concerns and that kind of follow-up information. So, and the other thing is, I know there's been a ton of information presented, and I just want to keep emphasizing that I think pretty much all of that information is on the website, which is coronavirus.pitt.edu. And I get that there is a ton of information there, but I think it's pretty well organized. But just want to keep reminding folks that is continually, as information becomes available, as the last of the required guidelines are put into place, they are all posted there. And the one other thing that gets posted there weekly is the count or identification of cases active cases within the university community. So those are posted every Friday as well. You can see from that website. So with that, hand it to you, Wanda.
Okay, thanks, Paul. Did you need to go back to the slides, or did you have any other ones?
No.
Okay, did you already go over the hotel locations? Did you do that in your first part? I just wanted to make sure that people knew which hotels were being used.
Yeah, I can answer that, Paul. The Residence Inn on University Medical Center on Bigelow Boulevard is one of the hotels that will be a residence hall, effectively. The Residence Inn on Forbes Avenue, 3341, and then that will be another place where we'll house students. And then the Wyndham Pittsburgh University Center on Lytton Avenue is the other hotel. So there are 3 hotels that we have where we'll have students living this year.
Thanks, Dean Bonner. Okay, so those are the locations. We did have one question that somebody was saying something about the Quality Insight on the Boulevard of the Allies, and that is not one of your locations, correct?
That's correct. It is not one of our locations. It just FYI, the university has owned that ground and ground leased to the Quality Inn, and the Quality Inn just recently gave up. It was about to come to an end, and they gave up their ground lease. So that'll be something that we'll be talking to the community in the future about.
And there's a question about, could you identify the location for quarantining students who test positive? And would students who live off campus but test positive be eligible for being part of the location for that? The supported quarantine living situation.
So the question is, if a student living in an off-campus residence tests positive, will they go into isolation? Is that the question? Yes. They will have 2 options. They will go either into the university located isolation, or they can choose to go home. But they will not be able to stay in their house, their apartment.
Okay.
Yeah.
Okay. And where's the location for the isolated living, the supported quarantine location?
Yeah, I'm probably not the right person to ask that because I'm not the housing expert. It's not just one single place. I think they have a group of apartments. They have, I think they've got 1 floor of our hotel. I'm not sure off the top of my head, but it's not one single place at the moment. I know that.
Yeah, we're using a number of university properties for our isolation housing around the campus, including one of the hotels. I think one of the floors, as Chris mentioned.
Yeah.
Okay. And I think you mentioned there was a question that came in during the presentation about how to report, if people see gatherings. And Dean Bonner, you made it pretty clear that people should use this reporting form that you've created, and that if you can get us that, we can make sure people know where to find that form. So we can provide some information on our website as well, so that people can find it easily and begin to learn where on your website that is located.
Yeah, absolutely.
And then there's lots of questions that I would consolidate together just in the skepticism category, right? Of, we see all the time that people don't do what they're supposed to do. And I would say that all the speakers have addressed that in one way or the other. Dean Bonner, you did. Dr. O'Donnell, you did as well. So any further thoughts on addressing those questions? Just generally, there was a Pitt News editorial that said you're delusional, people can't follow simple directions. What's your, I collapse all of those questions together.
No, I think it's a great question. I understand that perspective, but that's really not the reality of our campus. First of all, college students are adults. They're students, but they're adults. And so they're no different than all of us. Maybe some of us are more mature or have more experience, but they're adults, they're not children. And so I don't treat them as children, nor does the university. Yes, we deal with a lot of behavior that's pretty typical of that age group. But on balance, our students are really good students, and they comply with our policies and procedures, and they do the right thing. But what I'm not saying is that we will not have issues. We have issues in Pittsburgh. We have issues in our own communities. We have issues in our own families. That there will be students who don't comply. And the best we can do is educate them, make them aware. We can create a community in which it's more difficult to do that, and people will hold them accountable, not just us, but their peers. And then we have consequences for their behavior when they don't comply, and including they don't have the privilege of being in our community and putting other people at risk. And to the extent that we become aware of that and we find that to be true, we will address that behavior appropriately. So that is our process. Within the environment that we work, we're dealing with adults who have freedom of thought and expression, but we also have community standards and guidelines, and those will be upheld. And I think for the most part, our students will comply. And for those who don't, both faculty, staff, and students, there will be consequences for that. But I hope that that's the exception and not the norm. And that's been my experience as Dean of Students for 15 years.
There's a couple questions about, using the term community, that people think that when Pitt administrators use the term, they mean the campus. So people were just asking for a clarification, but those of us in the neighborhood often consider that to be the neighborhood. So there was a question about clarification, and I'll combine that with a question about, like, is it possible for residents to know the locations where Pitt students are living off campus? Not necessarily their personal information, but like where the locations where those students are living.
Maybe I'll let Paul, but I'll address this. But I'll just speak. The only place that we're 100% sure where students live is in university-owned housing, because it's property that we're responsible for. It's very difficult for us. Not even all of our students have their local address on file with us. So yeah, there are places where students live, and we've known them to live because of just sort of experience, but we wouldn't necessarily share, for security reasons and safety reasons and privacy reasons, like all of the addresses of our students. We obviously have a sense of where our students are congregated in the community, but I could not give you an absolute list of where every student lives in Oakland, for that matter, Pittsburgh, except for our university housing operations, where we know exactly who lives in those spaces.
I think that captures it, Kenya. And I think, in working with our community partners as well, we try to leverage the knowledge that they have, that you have about what they're seeing and what's going on. So we hope that as you see those things, and both good and bad, you will let us know. And you see, we're working with our students to make sure that they encourage compliance among their peers out in the neighborhood. And so that we hope that, for example, when you see that, you will reinforce that positive behavior as well. Let us know the things that look like they're working, or the things contrarily that are not, you don't see working.
And that brings up another question that I see, or a comment, I guess, that in some other parts of the city, groups are incentivizing or sort of rewarding people who are seen wearing masks, in the business district. Would the university consider implementing something like that, of, sort of rewarding good behavior, getting a gift card, doing some way of incentivizing and rewarding the good behavior that people are displaying?
I would say absolutely, and those things are still under discussion and in development. There are many things that we can do. It's not just the punishment end of it, but it's also the incentive of of being a responsible community member. So yes, those things are all on the table. We're all interested in it, and I'd also I just want to underscore, yes, please let us know if you see or you believe our students to be behaving in ways that are not safe. I want to know that. My team wants to know that, so we can address that behavior, because it's in all of our interest that people are complying with this and not endangering others. And the sooner we know about it, the more quickly we can intervene and address and try to correct the behavior.
Okay. And then two questions about, again, where people can get information. So there was a question about, will the code of conduct be released? And then I think, Paul, you said that the testing results are made public on a weekly basis. And the randomized testing that Dr. O'Donnell talked about, will that be made available to people in the public to know what the results are?
I think the plan at the moment is that Pitt is publicly posting the number of positive students that are coming through their system. In terms of the results of our surveillance testing, I'm not sure what the plans are for that, but it seems reasonable to me that that should be publicly available. We're very hopeful that it's going to be in the same range as Allegheny County, where we have, 1 in 400 asymptomatic students on the campus and in the neighborhoods. So I'm hopeful that we'll have good numbers there. I saw in the chat a question about the surveillance testing. I probably didn't do a very good job of describing that, and there's reference to testing up to 400 students a day. Since that release, we have become a little more refined in what the plan is. So we're bringing students back onto campus over 5 phases, 4 days apart. And the students in each phase will be tested over a 48-hour period because they come in 2 separate days. And we'll be testing about 250 students a day, which will give us about a 10% coverage of all the students coming in. Now, that 250 samples is not going to overburden the UPMC system, because I know there's been a lot of talk about that, because we're going to use a pooling system where we take 4 students and we pool their samples together, because we know that there's probably about a 1 in 400 chance of a test being positive. So what this allows us to do is to cut down dramatically on the number of samples that we need to go through the final PCR phase of it. So in that way, we're not going to be compromising, UPMC and what they need to do their regular testing. So the plan at the moment is probably to test around 250 per day for 10 days over about an 18-day period. So I hope that's a little clearer.
Yeah, that's helpful. Thank you. I think now I will remind people, Zoom can be exhausting, right, when you're on here for a while. So I think we'll try to wrap up. I really appreciate everybody's engagement and the presenters providing so much information to the community. But if there is somebody who's on the phone and hasn't had, who's not able to use the chat feature, we'll take a few seconds now. You can hit *6 and unmute your line. You can also hit *9 and raise your hand, and that'll show me that you are wanting to ask a question. Great. Hearing none, I think that we've addressed all the questions that I've seen both on Facebook and in the chat. And again, I appreciate everyone's active participation in the chat with questions, and our presenters providing this information is a great opportunity for the community to hear right from the source, and it is something of huge concern to the community. So thank you so much to everyone. And as you have some of the, I think that you have a lot on your website, but we may find a couple of those items that we might be able to call out specifically, like the reporting form and a couple of other things that we'll put on our website as well. Just so, and we can send that out on social media as well, just so it's a little easier for people to find those. So we'll follow up with the Pitt representatives to do that, make that available kind of so you can find it easily. So thanks everyone for attending. Again, this meeting recording will be on our website, and we'll also capture meeting notes that'll be available on the website as well. Thanks for attending tonight. We really appreciate it. Our
Thank you.
next meeting will be the end of August, so so stay connect. We'll just check the website. We don't have the agenda put together for that yet, but we will. So thanks everyone. Appreciate it.